Hey, I'm Dr. Kent, for those of you who have been in our practice that are our lap band patients. So I wanted to talk about a couple of things today. I've got a lap band with an adjustment needle, and you all know that we do an adjustment here in the office. And you can watch very closely in a lap band as I inject fluid and actually see how tight it gets around my finger. I can get this so where I almost can't get my finger into it. So when we put fluid in your lap band, that's what we're doing. And then of course we can take fluid out to make the band get looser. And the thing I kind of wanted to touch on today was what happens when your band seems to get too tight without actually having an adjustment. And sometimes I'm able to tell and sometimes I'm not, but once the band goes around the stomach, then sometimes people will eat something that gets stuck temporarily here and it goes by the band, but it causes swelling right in this area of the stomach where the band is placed. And sometimes the swelling goes away and sometimes it doesn't. Now it's pretty obvious to most of us that if you have some food get stuck and you throw it up and then you can't eat anymore and have pretty persistent vomiting, that's really a sign that you need to come in and get some fluid taken out of the band right away. And sometimes it's not that obvious. Sometimes the only symptoms of being too tight are things like heartburn or regurgitation. And usually that'll occur at night after you eat and then you go lay down and you'll have burning in the chest, or maybe it even will come back to your throat and cause a sore throat, or you'll notice some food coming back. So heartburn's another indication that you should call us right away and come in so we can take some fluid out of your lap band and let things settle down, so that you don't hurt yourself with your lap band. Remember, this is an artificial device that is going around living tissue, and anytime you have that sort of combination, you can actually have an injury to the tissue. So we don't want your band to be too tight. We don't want you to be injured. There are a couple other things I've found that people do when they get too tight. One of those is occasionally they'll think they have a sinus problem because they notice all this phlegm in the back of their throat and they can't seem to swallow, and they automatically assume that they're having a lot of sinus drainage. Well, probably what's happening in a lot of those people is that the band has become too tight and they can't swallow their own saliva, and what they think is, gee, that's sinus drainage, must be my sinuses. If you've got a question about that and you're having phlegm in the back of your throat, you better give us a call right away too, because sometimes these things can be a little bit difficult to sort out. The other things I've noticed are that when people have these sensations or when they burp a lot